September 9th. Welcome. Yes, I'm back. Again. So, grab a coffee and let's get smarter together. Out of good reasons, I will dedicate this first post back to a warning. COVID is still the same danger it has been from the beginning. I contracted COVID because from one moment to the next I was thrust into a reality in which it was up in me to wrestle my dad back from the threshold of death. My dad might be in his 70s, but he does the books for my mom's shop well enough that he stood the recent test of a thorough audit. He does the bulk shopping, and every weekend he walks hundreds of steps to deliver orders to customers. He also had used every COVID vaccination opportunity offered so that he's 4 times vaxxed. What he didn't do anymore, other than me, was wearing a mask, because he believed what he was told by politicians and the press, that this is over. And he wanted to believe it, not least because a mask and glasses don't go so well together. He deteriorated quickly. Within hours he had entered a fever delirium so severely, he has no recollection of several days. Memories that have burned themselves into my brain because the situations were so overwhelming and frankly scary never formed for him. It was only because I got hold of Paxlovid in short order that he's still with us. And because I put my whole focus on him, on making sure that he drank, that he had cold clothes and ice pads to cool him down in the heat of the summer, that he got to the restroom somehow, leaning on me, being dragged more than anything, that he and his environment was clean, and so on. All the while I was running high fevers, was caught in coughing fits. My sinuses were clogged so that my face felt like it would explode every minute. I had migraines, and most importantly, I was filled with a leaden tiredness that made every step feel like I moved through molasses. I too had all 3 vaccinations I, someone healthy in her 40s, could get. Both my dad and I are better now. Thank goodness. But we are far from well. My dad spends still all day in bed because the illness has robbed him of all his strength and physical fitness. I tire rapidly even when the task is normally simple, and have a hard time motivating myself to start the physical part of activities, like typing this post, which I had written in my mind already for a couple of days. We are not an exception. My dad and I, we are what is the reality. Currently, when you check the data, you will learn that wherever you look, one of the largest COVID waves we have experienced is sweeping through cities and the countryside alike. Why don't you hear about it? Because along the way, the question of whether the economy is a tool to make human life better, or whether humans exist to keep the economy going, has been answered toward the latter. Or better, the vast majority of humans exists so that a few individuals can make ever-growing profits. To fulfill their role, the vast majority of humans needs to exploit whatever existing knowledge is assigned to them and needs to consume immediately, constantly, with growing enthusiasm and without reservations. Masks, they represent reservations because they are a reminder of a danger that is literally in the air. Even though they would be the cheapest way to protect everyone, they therefore had to be demonized. You had to get rid of this mask because it is, whatever it is. It is not really a hindrance in daily life. it's a protection, but it reminds you that there is something you need protection against. And that had to go out of your head. Vaccinations, they represent reservations too. But also, while vaccinations are helpful, we should never forget COVID vaccines don't prevent infections and the spread of the virus. What they thankfully do, and why they are a miracle of science, is they prevent the worst outcomes and slow the spread of a pandemic down. For circa 6 months, stably, around that 1 year mark, their protection wanes out. What, when you do the math, explains the wave we experience right now. Most of us had their last vaccinations about a year ago in the fall of 2023. And you don't get herd immunity when you face an ever-changing virus like a coronavirus. And that's the best proof that herd immunity doesn't get to be achieved, we all would be immune by now to the flu, and the flu returns every year or is with us constantly, but the numbers are rising into the thousands every year, and a whole lot of people die or just are not the same afterwards, just don't have the same strength anymore to participate in society and vote and think through their votes and so on. So it's also a danger to our democracy, but that's for another day. When you're lucky, you have quick access to Paxlovid once infected. My dad had. But it costs far over €1,000 or dollars for a 5-day regime. That's okay, though, for the few profit makers, as they don't pay taxes, nor do they pay into the national health insurance networks wherever they exist. The same goes for all the people needing assistance because they can't anymore participate in society or do so fully because of long COVID. They are not a care of the profit makers. They don't pay for it. Or all the young and middle-aged people who need assistance instead of being a support of the social fabric because they now suffer cardiovascular events like strokes and heart attacks because COVID is not just a respiratory acute infection. It stays with us, and it is a blood disease. It's also a disease affecting the nervous system that's even capable to pass the blood-brain barrier and results in long-term damage that limits the capacity of people to participate. And this doesn't yet include the propensity of viruses to reveal their true face really only years after the initial infection. Like an infection with HIV gets really, really scary once it turns into AIDS a decade later. Or chickenpox that hide in our spine, the viruses, and turn into shingles. What will incapacitate you with severe pains and itching and everything for a year. Or diverse viruses like the one for woman diseases that cause cancer, and so on, and so on, and so on. But these are all not problems for those few Uber explorers for whom the rest of humanity exists to make a profit and keep their identity as an Uber explorer alive. And their calculation is that with AI on the horizon, it will never become their problem. In the meantime, they will try to balance the decrease in robustness of their workforce by forcing women to push out more babies. To do nothing else but pushing out babies they don't want or that might kill them, because that's how you bring numbers to the workforce that isn't as forceful anymore. You make abortions illegal, you make contraception illegal, and you get women to do nothing but bringing new kids into the world that then will be educated to the standards of the employer by taxpayer money and then be used to make profits for the few who never pay taxes. We are in a bit of a dead end right now. We need a plan, a real comprehensive plan for a fair and equal society. We don't have it. We don't have something like neoliberalism yet as a plan for everyone to live by and to work towards. But that shall be the subject of my next poses. For now, protect yourself. Protect your surroundings. It is your choice whether you do it and not anyone else's. Like, comment, share, and as always, follow lest you miss a single opportunity to improve yourself and society. Coming soon is this discussion about the society we want to live in. Once you do, we'll see you again at the coffee pot.